Hi, my name's Clare Walker and I'm a domestic abuse consultant. I work UK-wide, training professionals, as a visiting lecturer, social work students on their degrees. I run the support group and I'm an expert witness for clients going through family courts and immigration tribunals. I think the most important thing that a person coming from an abusive context needs is an education and information. So it's about, again, do you understand why you're here? I hear quite a lot of times from victims that are attending my group that they don't understand why they're in a mother and baby unit. They don't understand what the motivation is, what the outcome's supposed to be. They just think, oh well, we're there for some reason and then we'll be able to go back home, and that might not be the situation. Have you had any support or information on domestic abuse? Do you know why the authorities are saying you're placed here with us because of domestic abuse? Do you accept that? Do you acknowledge that? If not, then there's things like the Freedom Programme that they can access, and so giving them that support to read the book, to go and join a group, because that will ultimately help with their support and increase their learning. Then making sure that in the foster carer's role that they have imparted, this is the process, these are your choices. If you do X, then this will happen. If you do Y, then this will potentially happen. So they can make an informed choice. They might not still like it, but it's about addressing the power imbalance, because all the time they have been done to. So they've been done to by their dominator, and then they're getting done to again by the system. And there's kind of two ways we can look at vulnerability. And for some of us, if we don't get that right support and guidance and input, vulnerability becomes the thing that makes me more vulnerable. It makes me do risky behaviours. It makes me continue to have a relationship with an abusive person when I've been directed by the authorities not to, which would then, put me at risk of losing the child. If we get the right guidance and support, and we get that validation of, gosh, that must have been really difficult, but look how well you've done, and looking more at strengths rather than the negative weaknesses and what she hasn't done potentially, then that vulnerability can kind of be, something to be proud of, and say, look, this was my journey, and now I'm at the cusp of going home with my baby, and I feel better informed and better equipped and more grounded as myself, let alone as a parent to a child. So then they can embrace that vulnerability and say, it's part of me, and I'm proud of that.